Okay, so we are here today with Vincent, who's going to be talking to us about neuro-affirmative practice and has some tips for clinicians. I'll just introduce the speaker disclosure so we don't have any conflicts of interest to declare. And here are the CanMed's roles for today's talk. And the learning objectives today are to summarize helpful strategies for communicating and interacting with neurodivergent patients and review tips for working with individuals during assessments and procedures, and to describe some environmental adaptations that can accommodate for neurodivergent patients. So I'm going to turn it over to Vincent now, who's going to introduce himself.
Hello, everyone. I just want to thank you guys for welcoming me. So, my name is Vincent Lang. I'm 22 years old. I love to cook, try new foods, and hang out with friends from McGill since I come by here from time to time. I've been a self-advocate since 2018, and I've given talks to medical students and schools about autism and how to work with autistic people. And I was diagnosed with autism spectrum disorder since the age of 2 years old. So, tips for the clinicals. I've developed a list of suggestions of do's and don'ts. So, doctors, nurses, and other health professionals through my own experience at doctor visits. These are things that I find helpful or unhelpful, and they might be different for other people on the spectrum. And please excuse my communication, but this is just part of my autism as I speak. So, general tips for speaking to people. To do, you want to be patient, talk slowly, give time for the person to process what has been said or asked. You will want to use clear speech and as few words as possible. Too many can be challenging and overwhelming. Use accessible words, careful about the what to say, and be specific with your words. That's why they say think before speaking. For don't, you don't want to talk about a person as if they are not there, even if they may have communication challenges and have a caregiver speaking on their behalf or helping to support them. The idea to make sure it goes smoothly, you want to use visual when possible for history, exams, procedures, checklists, body maps. Ask the person or caregiver what was helpful in the past for similar procedures. Make sure to check in with the person or caregiver to ensure they understand what is happening or being asked of them. Do they understand? Do they agree to this procedure? Do they feel safe? Can you go ahead and begin? Allow a person to have it safe. If any support objects like a fidget spinner or a stress ball can help them remain calm, you don't, one thing important is to don't expect eye contact from anyone because sometimes this is challenging. It doesn't mean the person is not listening. It's just their way of staying calm. For setting up the environment, what you want to do is a quiet room can a quiet room scan to take consideration any possible sensory sensations uh, and what you can do to help reduce them, dimming or turning off unnecessarily lights or sounds, providing privacy and a safe space for the person. You'll also want to try keep the staff to a minimum when possible. Avoid many different people coming in and out of the environment, and something for a don't. So you want to avoid loud music and other loud noises. During the procedures or assessments, you should ask a person and let them know before you touch them. Explain what you will be doing. Use visual when possible, briefly explaining the process so they know what to anticipate. When then talk slowly, step by step as you go along the process. Take the time to investigate and ensure what may be lying beneath what is obvious. Hitting or pulling ears when pain in the stomach is an example. The don'ts, so suddenly if you like touch a person, even a kind hand on the shoulder without asking or letting them know, especially from behind where they cannot see you. Surprising someone like this can be stressful and even painful for some others. Don't assume anything. People can present and respond in different ways that may seem to point to something obvious. Look beyond that. Tips for taking on the history about the person. So
Whoops.
what
There we go.
so you'll want to ask the person when possible if you can, or if you will be communicating with their caregiver on their behalf. Keep the questions short and specific. You can ask the caregiver and allow them to provide valuable inputs about the history of the person. Find out what may be signs of increased distress for the person in person. So increase such as fidgeting, hand gestures, rapid breathing. Like how I communicate during this presentation, I use my hand gestures to just help me focus. Don't pressure or rush the interview, which is something I've had rough experience with growing up. And then for conclusion is to take the time to plan and prepare. Remember that you are dealing with a person, not a number, and reflect on your own practice and what worked and didn't work in the past. And that's all. Thank you very much for taking the time to listen to me.
All right. Thank you so much, Vincent. That was great. So we're going to take some questions.